Good morning. I am Dr. Sutharshan, consultant urologist. Just a few words about the introduction. Actually, I was born in Jaffna Peninsula in 1979, November 1st. I studied in my basic education at St. John's College, Jaffna. Then I entered the University of Sri Jawadnambara in 2000. There I completed my basic medical degree, that is MBBS, and I started my job as a doctor in Sri Lanka. Then I have did my postgraduate education at University of Colombo, and I completed my postgraduate studies, doctorate in medicine, in 2018 as a board certified consultant urologist in Sri Lanka. I did my foreign overseas training 2 years at London King's College Hospital NHS Foundation Trust, and I returned back to Sri Lanka in 2018, and I have started my career as a consultant urologist in Sri Lanka. Initially, I established the urology unit at DGH Kaluthura, where I established the first urology unit at that hospital. There I established all basic facilities about this field, that is urology, where I performed more than 1,000 surgeries, including endourological, open and laparoscopic procedures. Then in 2020, I had been transferred to General Hospital Ampara, where I served for 2 years as consultant urologist. There I performed the first state sector laser prostatectomy, that is holmium laser enucleation of prostate. It's called HOLAP. That was the first state hospital laser prostate surgery in Sri Lanka. Then in 2022, January 21st, I have joined the Sri Lankan Army as a lieutenant colonel, and I have established the urology unit in Army Hospital, Colombo. This is the first unit for the urology department in Army Hospital. Previously, there was no existing urology unit. All the patients were catered and transferred to National Hospital and other close by hospitals for the further urology care. Currently, we are establishing this unit, and now we are serving for more than 1 year, and we are catering all the soldiers and their families, ex-servicemen from all over the country. We get referrals from all over the country with regard to urology problem. We specially deal with the kidney surgeries related to kidneys and prostates, and also the cancer surgeries which involve any genitourinary tract. Nearly for so far, we have in this hospital we are performing the endourological procedures, we are performing the open surgical procedures, and also we are performing laparoscopic procedures, especially for the kidney, ureter, bladders, especially with regard to benign conditions as well as malignant conditions. So far we have performed more than 1,000 surgeries for this last 1 year period, and we have established a ward, urology ward, which is the ward 8 in the ward 8, and also we have two dedicated theaters, and also we have a dedicated medical officers and trained nursing team, and also the theater staff who have specially trained in urology. We have made several efforts to make this urology field successful in the Army Hospital, and we are working hard to improve this unit further with all the available facilities and the advanced technology facilities which is available around the world. Still we are pending, and we are about to get the other newer facilities to provide specialized urological care in this hospital up to the international standards. So far we have performed, and as I told you, endourological as well as open and laparoscopic surgeries. And this is there is one landmark surgery which we performed on the 1st of June 2023. There we came across a patient called Mr. Canistus, who presented to us with a right-sided abdominal pain. There we identified he is having a large kidney stone on his right side kidney, and we have done further investigations, and we prepared him for the major surgery, that is right-sided pyelolithotomy, and we have removed his large kidney stone on his right side kidney. There we measured the stone, and we got to know it is 13.372 and the weight is around 800. So initially, before performing this surgery, we have actually we got to know that this is going to be a Guinness record, because from the previous records we found out that the previous largest kidney stone was 13 centimeter and the heaviest kidney stone was 620 grams, which is in Pakistan, and the largest stone was in India. So we have applied to the Guinness community, which is operating from the London, United Kingdom. It is one of the complicated and a very tactful process. So initially we provided all the necessary investigations and regarding the members and also the investigation procedures to the community, Guinness Society, and we got the approval to perform the surgery on a dedicated date. So we got the informed written consent by the time we prepared the patient and for the anticipated complications, and according to the medical and also the Guinness required guidelines, we performed the surgery on 1st of June 2023, and we removed the largest and the heaviest stone in the world. And we by removing the stone, we actually achieved the greatest Guinness 2 double records to Sri Lanka, and which is one of the great famous not only to the army but also to our nation. So we achieved, as I told you, we achieved 2 Guinness records for these stones. After getting the Guinness record, actually this Guinness was recognized by the whole world. And also, in addition to the Guinness record, we will be able to get another 2 records. One is Asian Awards, and it was awarded to us for the outstanding urologist in Asia. And also, we get another record from another award from the American Society, and we received for a best overall urology performance in Asia. Again, we got 2 records, one from Asian Awards, and from the American Awards. Actually, we are glad to have several awards, including a Guinness record. So in future plans, we are planning this unit to develop further according to as per the international standards, and get on the further instruments and the modern facilities which still we are about to receive for this unit. So once our vision is to provide the international standard of urological care to all the people and the soldiers who are in service, giving their valuable service to the country, and also the people who have served the country and the retired people. So we are about to give our best possible care with advanced technology to the